masks do not work for the general public in preventing them from getting coronavirus.
Right. And at the beginning of April is when the administration started telling the public to wear masks.
I was saying that then because everything we knew about coronaviruses before that point told us that people were not likely to spread when they were asymptomatic. So the science at the time suggested that there was not a high degree of asymptomatic spread. We learned more.
All right, keep that in mind. The reason they say that we have to wear masks is because they now believe that coronavirus spreads asymptomatically. But then, fast forward to June 8th, when the World Health Organization's top infectious disease epidemiologist had this to say. And pay attention to how she summarizes the broad situation. When she's not talking about a subset of countries, she gives her generalized opinion about the virus.
What proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop, but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission. But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
You can't walk that back. She's talking generally about the virus. But something happened. Overnight, the masked tyrants must have contacted her and said, hey, wait a minute, you can't say that asymptomatic spread is rare because that's the whole justification for us to tell people to wear masks. So the very next day, she tried to walk back what she said, but she really didn't. This is what a non-denial denial sounds like.
There were quite a lot of messages that I received overnight and that we received about making some clarifications to some points that I made yesterday at the press conference. So I think it's important just to if I can briefly cover perhaps some of the misunderstandings from what I said yesterday. And so what I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know.
Yeah, you did articulate what you know, that asymptomatic transmission is rare. But it doesn't fit with the World Health Organization's policy of telling everybody to wear masks. That's what this is all about.
I use the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies.
If anybody believes that, just go back and rewatch the video.
I also referred to some data that isn't published. And this is information that we receive from our member states, through either presentations that they give at member state briefings or presentations that are given to us through teleconferences. As you know, and as we've said previously, we convene global expert networks, and at many of those we discuss a lot of ongoing research, ongoing studies that are there. And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission. What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit. And these are estimates. And there's a big range from the different models, depending on how the models are done, and where they've done, from which country. But some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
Yeah, she didn't include them because obviously she doesn't believe these models. She believes instead in actual contact tracing studies. And she understands that up until now, the medical establishment has always believed that respiratory viruses are not transmitted asymptomatically.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
How the hell do you have a study that says 40%? And yet there's a study in China of 10 million people and they found 0 asymptomatic transmissions. Or just this last December, there was a study out of the University of Florida that studied household transmission and found asymptomatic spread to be insignificant or statistically 0. And then we get to the issue of looking at data to see if mask wearing actually lowers cases. And probably the best study is one that compared counties in Florida, because in Florida they have some counties that have mask mandates and others that don't. And statistically, there was no difference. They also compared states that did not have mandates to states that did, and the states that did not did better. So the bottom line, masks just don't help.